Hi, I'm Dr. William Hatton, and welcome to my free 7-day at-home back pain management class. I'm excited to have you here, and let's get started by talking about how these classes are going to work. We're going to talk about today the anatomy of the low back, and in every class, the anatomy that we're using. Today, we're also going to talk about chronic versus acute pain, using heat versus ice to manage pain, the common causes of pain, using exercise or rest to treat pain, and when should you go to the doctor, and even what kind of doctor should you go see. On the anatomy of the low back, we have a lumbar spine, which is made up of 5 vertebrae, L1 through L4, that connect to the sacrum, which is the basis of our tailbone and part of our pelvis. The pelvis is made of 2 bones, which we commonly call the hip bones. This area is also rich with nerve tissue. Now, the low back can move in 6 degrees. We also call these the 3 planes of motion. The low back can bend forward and backward. It can bend left and right, and it can turn to the left and to the right. Chronic versus acute pain really is describing how long the pain has lasted. If you have had the pain for less than 6 weeks, regardless of the type of pain that you're experiencing, it is considered acute pain. If you have had that pain, that same symptom, for longer than 6 weeks, regardless of how you experience it, that would be considered chronic pain. Chronic and acute pain are usually treated differently via different strategies. Let's talk about heat and ice. Heat is usually good at helping the body move more fluidly and also reducing pain, while ice is all about helping the body slow down, but it also reduces pain. Ice is best for an injury that is less than 72 hours old because it is going to reduce the total inflammation in that injured site. Heat is appropriate after 72 hours only, and then that is going to be really whatever you prefer or whatever your goals are. If you're trying to loosen up, definitely use heat. If your main goal is to reduce inflammation and to reduce pain, I would choose ice, but both are appropriate and effective for pain relief after 72 hours. All right, so let's talk about the common causes of pain. We basically have 3 ways that the body is going to become worn out or injured. That can be degeneration, which usually comes from, believe it or not using something enough. Movement is the body's medicine and helps fight degeneration. Or an injury, like a slip and fall or a sprain or strain. You also have problems with faulty biomechanics. This would include bad posture, bad sleep hygiene, things like this that cause problems over time. Now, should you exercise or should you rest when you have an injury? Exercise is definitely going to be your best choice for chronic pain, and often that is just as effective or even more effective in some cases than drugs or surgery at reducing chronic pain. Rest is best for new injuries. In fact, when you get a new injury, you usually should rest that area for between 48 and 72 hours so that you don't risk further injury. Now, when should you go to a doctor? 1, if you experience any kind of major trauma, like a car accident or a broken bone or something like that, you should immediately go to an emergency room. Call 911. That is a medical emergency. If you have really bizarre symptoms, something really strange, I'm not even going to go into them, but if you're like, how could this possibly even be happening? I didn't know the human body could do this. That is a great time to go to the emergency room. Now, if you have like a little fender bender and you're not really experiencing a lot of pain and you're like, should I go to the hospital? Maybe you can go to an urgent care. That's a really great place to get started for any kind of moderate injury. If you are not experiencing any major trauma, but you wake up and your neck really hurts or something's really sore and it wasn't bothering you the day before, that's actually a great time to try a chiropractor. So you can use this chart to determine what you can try first for your particular type of injury. All right, make sure you tune back in tomorrow for our free low back pain management course.